Hello, leaders. Welcome back. I am so excited again to have one of my favorite guest co hosts, Dr. Scott Ellner, with me today. We are going to talk about all things that you can possibly imagine when it comes to artificial intelligence and how it's really having an impact in the field of healthcare and everything as a leader you need to be thinking about and all of those considerations that are just so important, and in particular how it relates to your employees and those healthcare workers and how you're going to support them in this journey. So Scott, before we get started, I love, I've always said I love your background. I love sort of it's just the energy. It makes me just feel like I can kind of hang out with you and we can have great conversations. But before we get started, remind our audience, I know you have joined us before, but just remind everybody a little bit about your background and why you're so passionate about this topic of leadership and healthcare.
Yeah, and Arlene, it's just an absolute pleasure to be on your podcast again. Thank you for having me. I enjoyed talking to you and learning from you the last time we met. And my background is really kind of twofold. I went into healthcare initially because of my passion for saving lives. I was a trauma surgeon for many years. And then I started becoming very interested in law and compliance and the implications of regulation within
Mhm.
healthcare, which healthcare is one of the most heavily
Highly
regulated
regulated, yeah.
industries, right? And so my background is I've studied in healthcare law, healthcare finance, and then was the executive CEO of a health system, and just launching a startup right now involving virtual immersive well care centers
I love it.
to
Love it.
improve access.
Yeah.
But I really want to talk about the thoughtful approach of adaptation of artificial intelligence or augmented intelligence in healthcare today. And so I'd love to just jump in and also get your thoughts.
Yeah, I feel like it's so timely because I feel like so much that we're reading, there's just, lots and lots of articles about like the need to regulate it, the need to look at it, the right, what are the benefits? And I think it leaves healthcare workers, let alone leaders, very confused as to how it can be used. So let's just talk a little bit about like, when you think about it and the work that you've been doing, what is something that you really think is important that we're missing sort of the mark when it comes to this as like another way of technology to be able to provide support to the people that we provide care delivery to?
Well, I think first and foremost, before I answer that question, because I think it's an important question, I want to speak to your podcast viewers, listeners, who I know many of them are healthcare professionals,
Right.
nurses, very well trained, highly educated people, physicians, technicians. Um, Artificial intelligence is not going to replace
Right.
the people closest to the patient. It
Right.
just can't.
Right.
It can't. And in fact, the American Medical Association came out in late November with a study that really looked at what are people's feelings about artificial intelligence. And in fact, they use the term augmented intelligence because it's not to supplant the great work that nurses, physicians, and other healthcare professionals do. It's to really augment their skill set.
Right.
And so I just want to make sure that what we're seeing out there is this proliferation of content around artificial intelligence, and it can be unnerving.
Hmm.
Uh, but to maybe put people at ease, to understand that this is not something where you should be concerned that a great nurse is not going to be replaced,
Right.
because nobody can replace that compassion, that kindness, and that skill that patients need.
Yeah. I mean, it is like the field of healthcare is humanistic in nature, right? I mean, we
Right.
heal people as human beings with our gifts, our skills, and our talents. Like, I really am convinced that this is why we're selected to go into the field, because like we're designed for that purpose. Like, that's who we are, and that is something that is never ever going to go away. Right. So I totally agree with you. And, I feel as if there's a lot of fear when it comes to artificial intelligence or augmented intelligence, right? Like people just having this general worry, like you said, right? Like, I'm just so worried about this. Like, I've talked to several people, especially like the field of like interventional radiology, right? Where it's like you see, right, that sometimes AI can spot things in an earlier stage or see things much more sooner than someone looking actually at the same information. So yeah, of course there's fear in that, right? People are afraid. So let's just kind of like talk a little bit about like what you see.
Well, I want to give an example of, as a surgeon where I would appreciate the technology.
Right.
So for example, there is a company out there, and I'm not promoting the company per se, but it's called Active Surgical, and it uses AI or natural language process or machine learning, I should say,
Hmm.
to identify certain areas when you're operating.
Mm,
Okay, so for example, as a general surgeon, and I'm dissecting out the gallbladder, there are certain things that you really want to be careful of ensuring that you're dissecting in the right location.
right.
And the worst thing you can do is cause an injury to what's called the common bile duct.
Hmm.
And so this type of technology is actually enabling the surgeon to identify sooner, okay, this is where you should be dissecting, stay away from here
Right. Right.
so that you can avoid an unfortunate injury.
Right.
Those are the types of things that I think that can be really helpful in improving outcomes and protecting patients from harm. Now, there are going to be legal, ethical, and financial considerations
Always.
with artificial intelligence. And I think it would be important to really dive into those because over time, as we evolve using these technologies in healthcare, we are going to be faced with some situations where, wow, was that actually helpful?
Yeah.
Was it harmful? Was it medically necessary? We're going to have to make decisions based on using these judgment calls based on the legal, ethical, and financial implications. So I'd love to jump into that at some point.
Yeah. And I think, what do you believe causes the fear? Like when it comes to like, do you think it comes from a place where, people are just so afraid of change? Like in this evolution of like medicine and change. As for me, the thing that excites me about how like technology is how quickly it is helping us evolve healthcare and healthcare delivery. Like that is so powerful to me. It's so exciting, but I recognize for so many people, there's a large group of people out there that might be more afraid, right? And they might be fearful of embracing it. Like, so what do you think causes that sort of fear or what do you think, how can we help people feel more comfortable just with just understanding it better and then understanding it how it would like augment, right? The way we
Mhm.
provide care.
It could be any sort of change. Doesn't have to be artificial intelligence. In my experience as a leader and also as somebody as a clinician, fear typically comes from feeling a loss.
Mhm.
So if I feel like the knowledge that I've developed over my professional lifetime isn't making the impact anymore,
Mhm.
then I'm going to be resistant.
Yeah. Yeah.
And
It's a little bit
so
of that ego, right? Getting in there a little bit.
well, there is some ego for sure, but again, remember, I mean, healthcare professionals, nurses, doctors, we go to school for a long time. It's very difficult to get into nursing school,
Yeah.
medical school, and you develop this, ability to treat patients, and then all of a sudden something new comes along,
Mm-hmm.
which could disrupt
Yeah.
our approach, including like the electronic health record. That was very disruptive.
Yeah. Yeah.
And so I think it still is disruptive, but we can go there another
I-
time. But
I-
so I think it's not necessarily ego. I think it's just this feeling like, am I going to have to learn something new?
Yeah.
How quickly can I adopt and be able to be facile in it like I have been, historically? And when you don't really understand something right off the bat, let's face it, artificial intelligence comes with a new vocabulary, large language models, natural language processing, machine learning, deep learning. It's like it's like how we speak to one another, PRN, Q
Right.
day, you know.
Right. Yeah.
So I think if we can maybe just simplify that it's an augmented approach to making us better, and here's why, and here's how we're going to help you, and you're still going to be that respected healthcare professional clinician, then I think we have a chance.
Yeah, and I love that. I mean, I honestly, I've just come from the camp that I think we always have to be open, right? And open to all the possibilities, especially because what we do really matters. Like we heal human beings. And so if we're just naturally open to different ways of doing that, I mean, what's the harm in that, right? But I also think that, the piece that I'm really curious about is the regulatory piece, like sort of like where this is going to evolve to sort of, and how that is going to affect sort of not only healthcare workers but leaders, right? So let's talk a little bit about that. Like, where do you see that piece coming? Because I know that's something that you're like really passionate about, and you're also just, that kind of aligns really perfectly with like policy and law and just like what you're shifting and moving more towards.
Yeah, so regulation is going to be incredibly important, particularly as we look at artificial intelligence and machine learning as a medical device
Mhm.
used on patients. And the Food and Drug Administration has a very strict protocol or application process called a 510(k) application, where you have to demonstrate through clinical trials for a new medical device, unless you can compare it to a predicate device in the past, that this is safe and effective. And so there will be regulation on AI technology, which will have implications on whether or not these medical devices that use AI will be approved for use. So I do think, the federal government, while regulation is important, the federal government will ensure that artificial intelligence is used in a safe and effective manner. Um, but there are certain instances where, what if you have an AI driven device which does cause harm,
Yeah.
and it wasn't being used by a physician or a nurse? Is there a private cause of action? Is there a civil wrong? So,
Hmm.
right. So as clinicians, we have a duty of care,
Right.
right? Based on a reasonable standard of how we care for patients. And if there is a proximate cause of harm, that then the patient may be able to have a remedy for damages from liability caused by that AI tool. Who do you go after?
Yeah. I mean, if you think about it, it's not just in the United States of America, right? It's around the world,
It's
right?
global. Yes.
Global. So it makes that makes it even more challenging, right? When you think about it from
Right.
that perspective.
right. So, and I think our interactions, our communications are now becoming global. And so the things that we're doing, it is a potential scenario that down the road, surgery can be done remotely,
Hmm.
where I'm sitting at a console and the robot from my direction is working remotely in another country.
Yeah, it's crazy.
That is a reality.
Yeah,
Uh,
yeah.
so those are examples of some of the concerns around law, regulation, tort law, regulation. Then you have to consider the ethical
Hmm.
implications. We're all different. Patients are all different. We know that. What's exciting about medicine is that no one person is the same.
Right.
Okay. So there are tools out there that we can use for artificial intelligence to help with diagnoses. However, there are algorithmic biases
Hmm.
based on the color of your skin, based on your gender. So, for example, if there's a skin cancer app or an app or an AI device used to detect moles on the skin, for darker skin individuals, the algorithm may not pick up on those moles. So we may have a misdiagnosis. So there's ethical implications there.
Yeah. I actually think I read something about that not too long ago. So it's so timely that you brought it up because I thought the same thing, right? Is this idea of like, medicine, what I love about healthcare and medicine is that when we really look at it sort of from this global perspective, like people from all around the world, right, need healthcare and they need healing and they need to be well. But when we think about, like we live in such a great country, right, where we have the ability to have great healthcare sort of at our fingertips, but we still have a population of people that don't have access to care, right? And then you look at around the world and the same is true, right? We have third world countries that, there is very limited access to care. So I am curious about like the ethical piece of that and what we think how we think that's going to affect medicine and access to care for people that have never had it before. I mean, do you ever think about that?
Well, I have. Is it top of mind? Well, I mean, I have a public health background,
Yeah.
and I think everybody deserves the right to have, basic health care. At what level and to what advances are we able to provide, particularly in developing countries? I'll give you an example. When I was in my residency, I traveled down to off the coast of Australia. There are several countries there, like Tuvalu, Palau, French Polynesia. I think it's called Oceania. My son's really good at geography. He reminds me, but
Yeah, right.
there was a paucity of trauma systems down in those areas where there was a high number of traffic accidents, and typically it was children who were involved, and trying to set up a system that helped people with sort of these global type of initiatives um, was very difficult. Now, with the use of artificial intelligence, we're getting closer to being able to build out those systems. And
Yeah.
so I think there is opportunity there from a global public health perspective on enhancing the access to care in a much more meaningful way. Um, Another example is I was exposed to a group who was looking at newborns who have kernicterus,
Mhm.
right? Which is deadly. Like if your bilirubin is too high, it can affect the brain. And there are now AI generated tools which can look at the levels of kernicterus through an application that's applied to the skin.
Wow.
And it's relatively inexpensive, but it can save the life of a newborn to determine whether this is just transitory hyperbilirubinemia or if it's a serious, deadly risk of developing kernicterus.
Wow. I mean, that's extraordinary. I mean, I think that's the stuff that gets me like excited when I think about healthcare, like and how technology is really going to help us advance. Like when you think about leadership and you think about them supporting team members, like what are some of the things that you think a leader can do to just start having the conversations around either the use of AI or augmented intelligence and really to just get to some of those very important things like that you had touched on, right? The ethical piece of that, right? And just to really make sure that, they're using it in a way that is not going to cause harm.
Yeah, it always, I'm a big Simon Sinek fan, and it always starts with why. And I think if you can really get to the hearts and minds of explaining why we're doing something, and hopefully it's not just for, financial gain. And in healthcare, I think most of us are in it because ideally we're doing it because it's our calling.
Right.
If you can go to the why, and people are somewhat reluctant or even recalcitrant to trying something that is not really fully understood, you have to understand, okay, why are they feeling this way? Um, Active listening
Hmm.
is
Absolutely.
huge, right? I know you talk to a lot of healthcare leaders, and really good healthcare leaders or excellent healthcare leaders know how to engage in a way where they promote active discussion and listening.
Right.
And so that's what I try to do to ensure that we can find a common understanding.
Yeah, I was going to say that the thing that I would add to that is like your ability as a leader to be open, right? To be able to look at alternative perspectives and not be activated, right? I think, that like really is the deep emotional intelligence work that's needed as a leader to really like recognize that, people have emotions. We're all emotional beings, right? And we have a tendency sometimes as humans to look at things one way, right? And the greatest of leaders are those ones that can look at things from multiple different perspectives. They may not agree with them, right? But they're willing to have the dialogue. They're willing to have the discussion, like to be able to see what am I not seeing that you're seeing, right? And because they're courageous to do that, they're not activated at the same time and sort of like, staunch and no way, right? I can't, like, we're not going to look at it that way. So I think that's also another piece of it, right? Is that ability to be open.
And you talk a lot about psychological safety
Yeah.
and the importance that of every health system and leaders should promote that that safety of being able to speak up and share your concerns, hopefully in a kind way.
Right.
When our emotions get the best of us, sometimes we forget how to be kind, but I really try to presume good intent
Yeah.
and I think that's worked really well. When people are really coming from a good place, but maybe they're not expressing their concerns um, in the best way, and you just need to you need to give them the space to share their concerns, and then you can come back around and say, okay, I heard what you said. Maybe we can talk about this. Maybe we can talk about it off to the side where
Yeah.
it's not creating a lot of um, um, attention.
Yeah. Yeah. And don't you think sometimes I think this is a piece that I see a lot in leadership, right? It can be very difficult and challenging to recognize when is a good time to have a conversation and when is not a good time to have a conversation, right? Like to engage in that active listening and to be able to hear different perspectives. I mean, we've all seen this like in practice. I know I've seen this. I've been guilty of it myself, right? Like it's just not a good time for me. Like today might not be my day, right? I'm not going to be the best listener. I've got things on my mind or I have a meeting I got to go to, or I've got a big project I'm working towards, or whatever it is that something's got going on. and I do think that's a big piece, right? Is you're thinking about like being able to recognize like we're not going to be perfect as leaders sometimes. Like we're not going to always land it well. Even those that have achieved mastery still are going to have an off day.
Yeah.
And I think like to your point, like you say, I always try to lead with positive intent. I think, it's an opportunity to remind leaders like when you lead with positive intent, like when that's the really the essence of who you are, right? That you create that natural space for someone to realize like if you're having a bad day, they're like, you know what, that's not Scott. Like I know Scott. Scott, like Scott's not that way, right? And
Mhm.
so maybe it's maybe that another time or another moment, and then even making it safe enough psychologically to say, like, all right, I'm gonna call an audible here and I'm gonna say, I'm so interested in this conversation, but now's just not a good time for me, right? Like to
Yes.
right?
Yes. I love that. That's one of my favorites to use when you're kind of walking in the hall and you got to get to a meeting and somebody approaches you.
Oh yeah.
The worst thing you can do is say, "Sorry, I don't have time."
Right.
But acknowledging them. I love how you said that because it's perfect. This is a great conversation. I'd love to follow up with you on this.
Right.
Yeah,
And I don't want you to feel like I'm not interested, right? And I
right.
think like the more we can encourage leaders just to like relax a little bit and recognize like, we're human beings. And I think the one thing that I keep doing this over and over in education and just reminding people like if we hold on to what we all have in common, which is we are healthcare, we're in the field of healthcare because we're the people that are wired to care. Like that's our DNA, that's who we are. It really makes us sort of distinct here in life school, right? That's our calling. And I think that's the thing we hold on to, right? We're all going to have differences in the way we approach situations or we look at the different situations. That's the beauty of healthcare, right? Because the way I'm going to look at it is not going to be the way you're going to look at it, right? But I do think we've got to just get more comfortable just being in that humanistic space that we talk about so much, right? And how that affects healing and how it affects us like working with another leader or whether it's working with another team member and how we keep them engaged and not feeling like we don't care about you because obviously we care about people, right? That's why we're in this business, right? We care about the people.
Absolutely. Your comments are resonating with me because as recently at the American College of Healthcare Executives Congress, and it was so apparent that there seems to be a paradigm shift in how leaders show up. And what you're describing is authenticity.
Yeah. Yeah.
I think today's healthcare leaders need to show humility, authenticity, transparency, allowing for diversity of thought,
Yeah.
and then be accountable.
Yeah.
And that's really, I mean, what your statement just really encumbered all of those. And I think that's how you can get people to, yeah, at least 80% of people to understand, okay, I, th- now I see where this healthcare leader is coming from.
Yeah, and I would agree. I mean, I think so many times when I think about all the leadership education I've done over my career, a lot of what I know to be true is that, team members can spot phony a mile away, right? So I always tell people like, you're in the best position. Like if you are a control freak and you're just that type of leader that that's who you are, right? There's nothing wrong with that. You just have to prepare your team members for that's who you are. Like you're going to try to evolve and grow and become the best version of you, but this is something that you're working hard at here in life school. You're not going to be perfect, right? But it has everything to do with me and nothing to do with you, right? Like it's
Mhm.
not like I'm circling behind you and I'm like, "Oh, I have to check everything that person does." Right? That's not where we get to. It's we're being authentic with somebody because when we are an authentic leader, like when we lead with the way we were designed with our skills and our gifts and our talents, like it just becomes more natural for us to grow and stretch in that space. Like, don't you think that? Like, you see that?
Yeah, I mean, to be your authentic self is also to admit when you don't know something, right?
Isn't that hard? That's so hard, right?
Oh yeah, it's tough. I'll share a little, just a quick story. When sometimes when things are really tough and you're really getting your feet to the fire
Mhm.
and you're in a group of people and you're being challenged, right? Here you are, you're the leader for that, either that department, that unit, the organization, and somebody's calling you out
Yeah, yeah,
and they are just, they're hot. They're
yeah,
they're angry. And you can see, the rest of the people are kind of like, they're like looking at you like, oh, what are they going to do?
yeah,
How are they going to respond to this person? I've learned, and it's taken me some time to learn this, to be still,
yeah, me too.
to be silent,
Mhm.
to pause,
Yeah,
to give it space.
right.
Because if you react right away, when, particularly in healthcare, when we're so passionate about doing what's right for our patients, if you respond right away, you don't give yourself enough time to, I think, respond appropriately. So that pause, or that quietness, or that stillness, even creating a little bit of air in the room,
Yeah,
can diminish the tension.
yeah.
And then I like to follow it up with humor.
Yeah, yeah. I love it too. Right? Levity is a really great thing. But I also think, when you think about it, I think this ability to pause and be still, again, I think too, when it comes to leadership, I think, this is really hard in the world that we live in because people have really just gotten into a regular routine of allowing their emotions to drive their response. And when you think about this in healthcare, as a leader, you're the role model, right? So your team is like looking up at you, right? And they're taking direction from you. And so if you're that leader and you're responding in a way that's reactionary, then no shock or surprise to you that your healthcare workers turn around and do that same exact behavior to your patients, to the families, to the visitors, right? Because you've said this is an acceptable practice, and people are looking up and they're like, yeah, okay, yeah, check, my boss has done that. And so that's really the opportunity that I see when it comes to leadership is how do we look inward, right? Because AI is not going to do that for us, right?
Right, right.
So how until AI can do that and like look inward and be like beep beep beep, Arlene, you're not like dialed in and you're not really like listening or paying attention. Like, what are some of those things that leaders can really concentrate on and do to really create that psychological safe space? Because trust is earned, right, through our actions and through consistency and through doing things over and over again that can be predicted, right? And that's where that sacred space lies when it comes to people.
You know, a good friend of mine just he shared a quote with me. I don't know if it came from him, but he said, "Trust is built over a lifetime. Hate is built over 10 seconds."
Oh yeah, ain't that the truth?
And it's unfortunate, but for whatever reason, the way that our primitive brain works, with the amygdala being hijacked and in
Mhm.
our emotional maturity, we tend to move toward the side of, for whatever reason, becoming polarized and even hateful. And as a leader, you just can't get pulled into that. You have to be able to manage your emotions in a way. It's regulation, really, and it's relationship management. And hopefully this will cut across the entire organization where people start to behave in a similar way. But you're right,
Yeah.
right? If you're nasty
Yeah.
or coercive
Yeah.
or intimidating,
Yeah.
people will think,
Same
well,
behavior.
that's the norm.
Yeah, that's what it is, right? That's how we work around here. And I do think, like, I think about the people that mentored me in my early leadership career and like really just worked with me just to look at things from that different perspective. I just think, some of that skill development is getting really comfortable as a leader of like supporting the people that you work with and alongside, right? To have those tough conversations sometimes when you can spot that somebody isn't really handling or managing a situation in the best way, right? And that can be full of challenges. I've had a lot of people ask me a lot of questions over the course of my career, like how do I handle this situation, or would it be appropriate to handle this? And I always circle it back by saying like, well, I want you to think about it like, what if somebody did that to you, right? Like how would you respond, right? So I just recently had a leader ask me that, right? Like they said, I had to write somebody up this week because this is what I saw and this is what I really felt really strongly about, and I also feel like the person might not be a good fit in our organization. And then I saw a secondary incident, so I really just keep thinking like, should I write this person up again? And I thought, well, let's think about this. Like, what's your job as a leader, right? It's to grow and influence, right? And get someone to self-reflect and really to look inward and to make change in a positive way, right? And so, how we do that is the way we engage with people through our communication, right? And how we reach inside them and we say to them like, "Hey, do you have 5 minutes? Because I want to just like have a conversation about something that I observed, and I want to talk about it openly and honestly because I want to believe that you might not have seen this in yourself. And, I'm here to support you and I want to grow you and I want to make you the best version of you. Right. And for me to do that, I need to share that with you. And I know when I used to educate a lot, I used to always tell people the story of like, it's kind of like with leadership. A big piece of this is, when you've had like we've all had like a poppy seed bagel in our lives, right? You have it for breakfast, maybe you eat it, right? And then you go around, you talk to 10, 20 different people. Then you go to it's like time now to go have lunch and you're going to go to the bathroom and then you go in, you look at the mirror, you're fixing yourself and you notice you have this like poppy seed in the middle of your teeth, right? And you're like, why didn't
Oh,
anybody tell me? Like, I mean, I talked to like 20 people. Nobody told me that I have poppy seed in my teeth. Why? And I want to believe that people don't tell you that because they're embarrassed, right? Or they're afraid, or they're like, I'm not sure how that person's going to respond. And that's just like leadership, right? It's no different,
yes.
right? Like leaders have to get comfortable to say, you know what? I don't want that person to walk around and know that they have that poppy seed in the tooth because I care about them and they would be embarrassed and I want to make them feel comfortable. And that's the way I'm going to look at the way I'm going to lead with them and share those difficult things and, talk about that. So I don't know, that always like resonated
Oh,
with me, right?
such a great example. I mean, and believe me, I've had a lot of poppy seed moments. And I'm
Me
like,
too. Spinach, poppy seed, you name
yeah.
it all, right?
And you're right. And for whatever reason, those 20 people that you interacted with, maybe they thought they were going to hurt your feelings, or maybe they just didn't care.
Right. And that's even more scary.
Right. So, and which is disengagement.
Right.
And so if you've got that trust, like my wife, she'll
Oh, yeah.
say, oh, you got,
Yeah.
or your collar is screwed up. You want to be in a situation where people around you feel empowered to speak up, because it's not just about them. They're looking out for you.
Yeah.
And ultimately, everybody feels good about working together as a team.
Yeah. And that circles back to like your work and how you're passionate about like that psychologically safe environment, right? That just culture, right? So like if you're the leader and you have the courage to kind of step up and do that, and you do it from a place of love and you do it from a place that you care about somebody because you you would hope that somebody would do that, right? You lead by example in every single situation, right? And I think that is so, so, so important. And I think sometimes leaders miss that. And I often wonder about that sometimes, like why that's missed, you know?
Well, my theory is that maybe that type of training isn't really instilled in our early education, whether we're in nursing school or medical school or pharmacy school. The training around high reliability
Hmm.
wasn't something that I received until I was already in my career. And I really believe that those principles around high reliability organizing are important. I mean, they do it in the airline industry,
Right.
right? They do it in the nuclear power industry. The healthcare industry, it's probably something that should be part of our initial training, because it only will help with communication and building trust among teams. And healthcare, to me, is a team-based profession.
Yeah.
So I think that there is an opportunity, and I know you're a wonderful educator, and these are opportunities for us to educate the rising generation of next professionals
Yeah.
in this type of approach.
Yeah. I would agree. And I always think that, for us to do this important work, like every single day and keep at it and keep inspiring people and connecting them to their passion, to that deep sense of purpose, like why they're here on this earth, and to like make them see it and make them feel it. Like to me, that's what healthcare it needs so much right now, because in that post-COVID world where we're all like still wishing like it would return back. Like I know there's not a single person I talk to that's like, God, I just wish we could go back like pre-COVID, right? And I always keep telling people like instead, because you and I've had conversations, like we need to have the dialogue of what didn't we do well in COVID? Why didn't we do it well? And how do we protect ourselves so that the next time we have a big pandemic, we do it better the next time, right? And we can't go back in the past, right? Like COVID happened for a reason, and for us, I'm still trying to figure that out why it really did happen. But I want to believe that it happened to teach all of us that are in healthcare that the system is so fragile and that we're dealing with human beings in the end of the day, and the people that they love are attached to those people that we provide care to. And boy, did we see that during COVID, right? I mean, we really saw the impact of like family being cut out, people passing away alone, and then the burden, the psychological burden that was held on every single one of those healthcare workers that was there at that person's passing, knowing that their family couldn't be present, right? I mean, I know I still feel it. So,
Yeah, that alone, not being able to be with your family member during that time, even if you were in the hospital for a good reason to have a baby,
right, right.
it was so hard. It
Oh,
it was, and it was certainly depressing, and it weighed on so many people. I think it added to that loss of connection, added to some of the incivility,
yeah,
potentially even some of the violence.
yeah, I agree.
And we need to rethink how we approach that, because if there is something down the road where we not have a phase 2 pandemic or something like that, I mean, there's a lot of things I would do differently. I wouldn't shut down things. Absolutely not. I wouldn't
Right.
shut down things. I would have allowed family members to be present around their loved ones, because I think, and especially spirituality and religious, uh,
Yeah,
there's religious needs too. People get healthier when they have their priest, rabbi, chaplain, imam there for them.
Right. Absolutely. 100%. And I think that, I'm hopeful that, we can get to a point where, you and I have talked about this, like we really want to study this, right? We want to like go deeper with like every healthcare, worker around the world to say, what's that one thing, right, that you would have done differently? And like, let's look at it from that lens of research to say, like, how could that change? To prepare all of us for that next time. So I do think that's a huge opportunity for us. I also think like I think technology was amazing during COVID as well, because I know for me, I've talked very openly, in those early days, boy, I mean, I was on Facebook and on Facebook groups and just like trying to figure out what other people were doing in other countries and how they were providing care because like, even though I was in New Jersey, New York was not far from us, and then it started creeping down in New Jersey. But just seeing what was happening in like in like New York and Italy and like different parts of the world, it was terrifying. But then to hear like this is how you do it because it was so foreign, it just none of us were prepared for it. So I think it just reminds us how fragile the system is. And I think if we go back to that beginning of what we were talking about with, augmented intelligence and why that's so important, like we have to be open to different ways for that exact reason because our healthcare system is very fragile. It requires workers that are caring and compassionate to be at the helm and to do it every day despite what's happening. And that is so hard for so many people to do. I know for me, I talk openly about that. I pulled out of everything in social media. Like, I mean, I disappeared. Like, people were like, "Where did Arlene go?" I had people like sending messages like, "Is Arlene okay?" Right? Because I think the natural tendency for me was I needed to draw in, right, and like create that cocoon of where like I was like, I felt like I was, protecting the only thing that I could have at that moment, right, which was myself. Like, did you see that for yourself or anybody else?
Oh, I saw it a lot. I saw a lot of people who, became inward facing, and then I saw a lot of people who were external facing. And then I saw a shift too. I saw some people who started to come back out and feel more comfortable. Um, I think in the beginning, when we saw people supporting healthcare workers,
Oh yeah,
uh,
wasn't that
it
great?
was it was a special moment,
Yeah,
and I wish we never lost that.
me too.
But unfortunately, we sort of hit a point where um, that was lost, and I don't know. That would be something to study too. Is what was the social implications for all of a sudden? And I'm going to say this carefully, but turning against the healthcare worker.
Yeah, yeah,
That was really hard. That was painful.
yeah. And I want to believe, Scott, that that came from a place of people's loss and grief and loss of control, right? And being shut out of care delivery and being pulled away from their loved ones. I do believe that there are people out there that also need healing from those experiences because, you know, they're having difficulty stepping forward and saying that that was acceptable and okay. You know this. I know when I was an oncology nurse, there were, I used to say this all the time. And I truly, truly, truly believe this based off experience of being an oncology nurse for 2.5 years, right? People, I believe, choose when they want to go in that last moment. I've seen it a million times, right? I've seen it when people are waiting for like everybody to be there and then they go. And I've seen it when like the family's like, you know what? We're going to go down and get a cup of coffee and we'll be right back. And literally, they walk out of that room and a minute later, that person goes, right? So I do think like that piece is really hard for people with loss, and in healthcare, I think for leadership, it's just an opportunity to just recognize like the people that we care for every single day, they're still carrying a lot of that residual too.
Yes. Yeah. Yeah. Well, there's something I want to expand upon as part of that. And you've said it a couple times on this podcast, fragility.
Yeah.
Um, we talked a lot during the pandemic about being resilient. Um, but I think it's more than that. And there's a term that I learned a couple of years ago from pretty inspiring author by the name of Nassim Taleb, um, called anti-fragility.
Yeah.
And the notion is that when we fall down, when we have an adverse event or experience something that's, beyond our control, rather than get right back up,
Right.
and kind of put ourselves back in the situation, instead, and that can be considered resilience, but instead of getting right back at it, turn inward and reflect. And it's
Right.
kind of what you were talking about. It's what you reflect. So what's happening right now?
Mm.
What am I learning from this situation? What can I take from the situation so that I'm better next time? And and that is the concept of anti-fragility. And it's much more powerful than just resilience.
Right. Because you're coming back stronger, right?
Right.
Yeah.
Right.
Coming back as a stronger person. And I think that's how we have to look at it, right? I mean, for me, I know that's been part of my healing journey. Like, when I look back at all those, and believe me, I wish someday I could like transcribe all those journal entries. Right now, it's still too very difficult for me to do. But I do think when I look at the central themes, it is that, I try to reframe it out like those experiences happened to me because I had, skills, talents, and gifts at that time, that moment in time that were necessary and were needed, and that I was able to do it, even though I didn't believe I could do it, or I didn't know how to do it, or I didn't want to do it. I still did it, and that's what I'm hoping that all healthcare workers will take, and that leaders will also deliver that same message, back to their team members.
Yeah, I'm hopeful. I recently was in an I was with a health system, doing some work, and somebody from the leadership team said, our physicians need to heal.
Yeah.
And I said, okay, so tell me about that. Explain, give me an idea of what you mean by healing. What do you think needs to be done? And when I asked the leadership team what that meant, and then when I went to the physicians and I asked them what that meant, there was a chasm.
Yeah. Isn't that true?
And so, in order to create that healing, we really need to come together. And it goes back to creating this common understanding of how are we going to get back to a point where there's trust, which we may have lost,
Mm.
and work on that healing because there's going to be a lot of PTSD.
Oh, yeah. Yeah. And I think we have to be like kind and loving to one another because, we know how hard we have worked to get into this field, right? And to build our skills and our gifts and our talents, right? And to me that is the thing that terrifies me, that keeps me up at night, is the loss of talent, um, and the
Mhm.
loss of all of that knowledge and skills because we're not addressing sort of the undercurrent of what's happening to the person and how we can create a more healing environment for them, whether they take 5 minutes out of their day or they just, find some time to in reflection to come to a safe space with their leader to be able to say like, I need a moment, right? And that they're given that safe space to be able to do that.
one of the best ICU nurses I ever saw who did that well. This was when I was the CEO of a health system. She was so good. She was the charge nurse for the day, and she would go from room to room, and it was a full ICU with 32 rooms. And she's like, "Do you need a break? What can I do? How can I help you?" And just watching her in action,
Yeah.
that type of behavior was not only just was inspiring, but it instilled a trust that someone has my back.
Yeah. And we've got to figure out a way to teach that, Scott. We do.
Yeah. Like just because you have a really sick patient on hemodialysis with multiple drips, um, doesn't mean that, somebody can come in and give you a break for a few minutes or make sure you eat your lunch,
Right. Go to the bathroom. Yeah.
right? And because that is hard work. That
Yeah.
is incredibly hard work. And so I just loved, watching her work. It was magical. It
Yeah.
was just so impressive.
It's transformative. And I think for healthcare, I think really this is the moment, right? Coming off this pandemic, like to me, it's the moment to say, how do we as leaders transform healthcare? And so I want you to think about that for our closing. Like, when you think about it, like as a leader and somebody that is able to influence so many physicians and healthcare workers, like, what is that opportunity we're missing to really transform healthcare?
It's not innovation necessarily. It's not artificial intelligence. It's probably three things. Number one, words matter. So what we say and how we say it, and the integrity behind those words, it will make an impact. So that's one. Two, and I mentioned this early on, is always presume good intent. People are working really hard, and it may be that they just don't have the resources, or it may be that they're having a bad day. Presume good intent. And then the third is always remember that, particularly in healthcare, as a leader, we have to remember people went into this field because it was a calling to serve those who are more vulnerable. And so make sure that we always value that person's input.
Oh, I love it, Scott. I just love it. And I'm going to tell you, before we sort of end this podcast, because we could talk, you and I can talk for hours. I feel like um, the universe always brings us together because we have important work to do, right? And you're definitely gonna, we're gonna continue this conversation in another podcast. But just before we end, and I want to just say thank you for everything that you do in healthcare and everything that you're doing to help transform healthcare, even from that legal and policy perspective, and just as a physician, right? Because you speak the language and that's so important. But just remind our audience how they can get in contact with you if they want to reach out to you and connect with you and just learn more about all the great work that you're doing around, like, safety cultures and just creating this psychological safe place for people to work.
Yeah. So they can reach out to me through my LinkedIn page, which is Scott Ellner, DO, MPH, or my email. I'm happy to give that out, SCE107@mail.harvard.edu. And I'm hoping we can get together in the fall because I'll have a book coming out.
Oh, I'm so excited.
Yeah, and the title's out. I think we're gonna run with this title. It's called, so I grew up surfing, and
I knew this is why we had a connection. Yeah.
it's called Wipeout, Rise Up, a surf session in leadership, pushing past limits, and sustaining health.
I love it. And I'm inspired by that. Listen, I facilitate a writers group with a bunch of women. And so I do a lot of writing and I'm too working on a book too. Yeah, I really wish I could do the COVID sort of thing, but I think it's just not right. It's not the right time, right? So everything in life happens at the time we're supposed to be. I truly, truly believe that. And I just want to say, first of all, thank you for your time. Like, thank you for everything that you do. And I look forward to us working together, on future podcasts. And like you and I have talked, like we've got to do more, even on LinkedIn to just get people to start like engaging in that dialogue of like how we can learn from these experiences to propel forward, right? So I'm looking forward to that too.
Absolutely. We have a lot we can do together. So
Absolutely.
it's just a pleasure. Thank you for having me on today and love your show. And, we'll continue to work together and
Absolutely.
move forward.
Yeah, absolutely. Listen, I hope you enjoyed this podcast and I hope that you took some learnings from this and it's going to make you go back and sort of think about, how you can take what we discussed and really put it into practice. So, thank you for all you do and I look forward to listening with you on a future podcast. All right, goodbye everybody.